Resurgence thanks to ECMO. Grandma is 72 years old. She was a passenger on the cruise ship Diamond Princess. This is a luxury ship in Japan. And translation: COVID-19 outbreak in Japan since the ship. This luxury class docked at Yokohama Harbor. While quarantined on board, throat smear results show she tested positive for coronavirus 19, also known as COVID-19. That means she's got COVID-19 pneumonia. She was taken to the emergency room with a fever, difficulty breathing after for days. Point of attention: she has a long history of chronic conditions, diabetes, chronic kidney disease, and she's also obese. Analysis. Genome sequencing and full gene indicates that COVID-19 is a beta coronavirus in the same subtype viruses with respiratory distress syndrome. Structure of the gene region that binds to the receptor, and they're just the same specific. Conversion enzyme azinetensin 2 to invade the cells. This is how it gets into the human respiratory system. As it enters the cell, it's injecting its RNA into the lung cells. Instead of doing the usual job, the cell will synthesize the material itself. COVID-19, this just killed cells. It's just created more viruses. But it's not just the lungs that are the only places where it's possible. Gastrointestinal heart also has. So patients can have multiple organ failure, especially heart failure. The most important thing can cause quick death. In the emergency room, she's awake. However, she breathes rapidly and must be supported by an oxygen mask. After admission to the hospital, CRP white blood cell indicates inflammation occurring in the body. In addition to the virus, she's infected with more bacteria. She continues to breathe oxygen and antibiotic treatment for severe pneumonia. On the third day, the pneumonia got worse. Increased serum cholesterol levels. The amount of urine is almost or not. Metabolic acidosis. It shows that her multiple organ failure has appeared. Severe respiratory distress. The doctors determined that the reason for hypoxia is not chronic kidney disease. It's because of ARDS. It's called acute respiratory distress syndrome. And the infection caused multiple organ failure. What is ARDS? It's acute respiratory failure when the lungs virus damage. The toxins and the bacteria will be and the immune system will respond immediately. It releases chemical intermediates that cause inflammation in the alveoli, and the macrophages of the vessels will release oxidants. Intermediates. Damage to the endothelial surface of the alveoli. Damaged alveoli. Blood vessels dilate, filling the alveoli with fluid. The normal person's alveoli contain a little bit of air to exchange oxygen for the body. A person with lungs filled with fluid like a Mrs. I wouldn't be able to breathe. It's like a drowning person. The only difference is that she's drowning on land. This condition forces doctors to respiratory support by intubating and ventilating. Grandma immediately to the intensive care unit. And then it's intubated. Breathing on Saturday. Extensive lung pulmonary embolism in the lower right lobes. As everyone can see, the tear progressed to all the upper lobes. Her clinical condition is getting worse. The doctors immediately made a decision. Blood filtration and ECMO. ECMO exchanges oxygen, or better known as the artificial pulmonary heart. When the patient's heart and lungs are damaged, it does not guarantee the body's ability to survive. But it doesn't even rest. You have to try harder to help your body. It's like when you're already sick. They also have to work. Increase CA. ECMO allows the heart to hope rest for their recovery. So ECMO is a hyper-modern technique today. To help you, the patient's heart and lungs may have time to recover. But it's not universal. It can start a revival for people. It's just a measure to extend the time to help the heart and lungs. The hope is that the heart and lungs are able to recover. After the emergency is stabilized, the emergency doctors started working right away. The treatment measure: continuous kidney replacement for grandma, early nutrition and rehabilitation for grandmothers. Pulmonary x-ray shows that her lungs have improved. I hope to be back with you when your heart breaks. You are lucky to have time to rest. ECMO has pulled on. After 6 days, ECMO condition ECMO was improved. Suspended on the 12th day. Since she was in the hospital, 13th day lung condition improved. Pulmonary embolism is improved on the right lower, and all depending on. She was intubated on day 19. So COVID is a pandemic of humanity. It's dangerous because it can be fatal and can spread land widely. My advice is don't worry too much. Stay alert and protect your health. wearing a hand wash mask regularly. Stay healthy and happy.